alright? Can you hear me? Are you alright? Hey, you should stop that. You could be hurting yourself. Seriously. Can you hear me? Okay, you need to stop that or I'm gonna have to call for help. Yes, I have a girl here at Lake County Public Library who's acting really odd. She won't move from this awkward position and she keeps scraping her fingers on the ground. And I fear she's gonna injure herself if she doesn't stop. Can you send help? Okay, great. Thank you so much.
Paramedics arrived on the scene and spent nearly 10 minutes trying to get Sean to unclench his muscles and stop his repetitive movements. Eventually he did, and they brought him to the hospital to be evaluated. They recommended him to a therapist named Dr. Ishan, and he went to visit him the next day.
So, how are you doing today?
I'm doing well, thank you, doctor.
So it says here that yesterday you had rather bizarre behavior yesterday, is that correct?
Yeah, that's right.
So I think I have a slight understanding of what condition you might be under right now, but to make sure, I'm going to list out some symptoms and just tell me if they apply to you.
Okay.
Okay, the first one is disturbance in movement, and that's when you have excessive movement or a lack of movement, either called catatonic excitement or catatonic stupor. Repetitive movements are those that you can't control but feel compelled to perform. There's also waxy flexibility, which is where you are stuck in a certain position for an extended period of time, and it's really hard to come out of that movement.
Yeah.
There's also echolalia, which is where you repeat other people's words, and there's also echopraxia, is when you repeat other people's movements. And then there's posturing, which is when you put yourself in a bizarre body position and for quite a bit of time, and when your body resists attempts to rearrange its position. Do any of these apply to you?
Yeah, I think the posturing and the stupor and the negativism and whatever it's called, waxy flexibility. But the incident yesterday kind of speaks for itself.
Do these symptoms interfere with your daily activities?
Yeah, they do. I had an episode at my work and it freaked out the customers, so my boss fired me.
I think I have my diagnosis. It's called catatonic schizophrenia.
What is that?
Catatonic schizophrenia is a subtype from the larger schizophrenia, which you've probably heard of. And it is defined when you have bizarre movements, body movements, or lack of movements, and that's when you're just immobile for a long period of time. So, yeah, that's catatonic schizophrenia.
Wait, what treatments are there? Is there any way to get me to behave normally?
There are many different treatments, but for right now, I'm going to prescribe you a medication and see how that goes. And if not, then we can do something else to try to help you.
Okay.
So the first one, which I'm going to give you, is called an anxiolytic, and it's called benzodiazepines, and it acts as a tranquilizer. It's the most effective drug and usually relieves the symptoms most efficiently. Normally with schizophrenia, normally for schizophrenia we would prescribe you an antipsychotic drug, but for catatonic I'm going to give you the benzodiazepines, and you can take this for 3 weeks, and after that you'll come back and we'll see how things went. If not good, then we'll do something else.
Okay. Thank you so much, Dr. Ishan.
I'll see you in 3 weeks.
All right.
Hey, how's it going? Are you feeling okay? Come on, snap out of it. Do I need to call again? Oh no.
Sean took the drug for 3 weeks. He had 2 more episodes and had no noticeable improvement, so he went back to Dr. Ishan to discuss more treatment options.
So how are you doing, Lauren?
Not very well. The drug didn't seem to work. I had 2 more incidents and I'm not really improving.
Okay, that's okay, because we still have one more treatment we can try. It's called electroconvulsive therapy. It should give immediate results, especially for catatonic schizophrenia patients. Treatment would include 6 to 12 sessions twice a week, and if you're in danger afterwards, we can also give you 1 to 2 more treatments after the first session.
Alright, I'm willing to try it. I need to stop my weird behavior anyway.
Okay, then would you follow me to the first session? Alright, this should take 10 to 12 minutes, okay?
Alright.
I'm gonna be giving you the shot right now. Blood pressure. And now, cut.
Sean underwent 8 ECT sessions over 5 weeks' time. After the final session, he agreed to meet with Dr. Ishan after 5 weeks to check on his progress.
Go. Hello, Lauren. How are you doing?
I'm doing a lot better. The symptoms seem to have dissipated quite a bit, and I even got a job and managed to keep it, so now I'm even up for promotion.
That's good to hear, Lauren. Do you think you might need any more sessions?
No, I think the ECT really did the trick. I haven't had any problems.
Okay, that's probably it for this session then. And if you ever feel like your symptoms are escalating, then feel free to call me and we can talk about it, and I can prescribe you any more maybe some more medications, or we can do another ECT.
Okay. Thank you so much.
Glad to help.
Hey, how's it going? Are you feeling any better?
Yeah, I'm doing a lot better. I talked with my doctor, Dr. Ishan, and he gave me some meds, and they didn't really work for a while, but then he assigned me some electroconvulsive therapy.